The familiar phrases that are supposed to protect your brain may actually be silently causing a stroke while you sleep. Imagine sitting next to your grandchild, reading their favorite story. You're enjoying this peaceful moment when suddenly your throat feels dry. Your mouth can no longer speak, and you can't lift your arms. Your body becomes paralyzed, and you can't control it. There's no pain, no warning signs. The next morning, you find yourself unable to do the simplest tasks. That's a stroke, and it can happen while you're sleeping, without you even knowing. As a neurologist, I've encountered many elderly patients who live healthily, exercise regularly, eat a nutritious diet, yet still experience a stroke. They had no warning signs. These people, who seemed perfectly healthy, fell victim to this danger due to one mistake. They never thought about the very vitamins they take every day. The vitamins you trust, believing they will protect your heart, bones, and brain, could actually be doing you harm. And not all vitamins are as safe as you think. As we age, our bodies no longer function as they did when we were younger. This change can make certain vitamins dangerous, even leading to unexpected side effects, especially when combined with medications or sudden dietary changes. Strokes can happen at night when blood pressure drops, hormones shift, or blood clots form uncontrollably. And the scariest part is that these factors often occur without you even knowing. So which vitamins could cause this danger? Why can foods and vitamins that seem safe actually lead to a stroke? Let's explore in the next section to better understand the hidden risks of the pills you take every day. When we think of vitamin K2, most of us immediately associate it with bone health. It is heavily advertised as an excellent supplement that helps prevent osteoporosis and strengthens bones and joints, making it a popular choice for older adults, especially those concerned about bone loss. However, there is one important thing that very few people know. Vitamin K2, when not used correctly, can have dangerous effects on brain and cardiovascular health, particularly when combined with blood-thinning medications like warfarin. You might think that if vitamin K2 is good for bones, there's no reason it could be harmful. But the reality is more complicated. Vitamin K2 has the ability to increase blood clotting, which is why it can counteract the effects of anticoagulant drugs. If you are taking a medication like warfarin, which helps prevent blood clotting to avoid blockages in blood vessels, adding vitamin K2 can cause the blood to clot more quickly, leading to uncontrolled blood clots and an increased risk of stroke or cardiovascular problems. I'd like to share a story about a patient I treated, Mr. Raymond Steele, a 78-year-old retired firefighter. He was very careful about his health, always monitoring his cardiovascular health and taking blood thinners as prescribed by his doctor. However, one day, he listened to his friends and began taking vitamin K2, hoping to improve his bone health. Just 3 weeks after starting the supplement, he suddenly fell, could no longer speak, and one side of his body became paralyzed. When he was rushed to the hospital, doctors discovered he had suffered a stroke, and the main cause was the interaction between vitamin K2 and warfarin, which caused his blood to clot too quickly. Vitamin K2 had altered the balance in his body, leading to serious consequences he never anticipated. Taking vitamin K2 without medical supervision is a mistake that many older adults may make. While vitamin K2 is beneficial for bones, it can also cause severe harm if not used properly, especially when the patient is on blood thinners. For those who are on anticoagulants, vitamin K2 can increase the risk of blood clots and stroke without you even knowing. What's concerning is that very few people are warned about this dangerous interaction when they start taking supplements. When you trust a vitamin label without thoroughly checking it, you might unknowingly put yourself at risk. Therefore, before deciding to take vitamin K2 or any other supplement, especially if you're on blood-thinning medication, always consult your doctor to ensure your safety. Biotin, also known as vitamin B7, is one of the most popular vitamins in beauty products, from supplements that promote hair, nails, and skin health to anti-aging vitamins. Biotin is often advertised as a miracle that helps maintain a youthful and healthy appearance. It's not hard to find these supplements on drugstore shelves or in online ads, especially for older adults who are concerned about thinning hair, weak nails, or wrinkled skin. With promises of natural beauty and significant aesthetic improvements, biotin seems like a great option. But what few realize is that, in addition to its beauty benefits, biotin can pose serious health risks, especially when taken in high doses without fully understanding its potential side effects. One of the biggest dangers of biotin is its ability to interfere with the results of important medical tests, particularly those related to cardiovascular health and stroke. The story of Mrs. Eleanor Grant, 76, clearly illustrates this. She was proud of her beautiful silver hair, and, to maintain her appearance, she started taking 10,000 mcg of biotin daily, a high dose she found through an online advertisement. One morning, she woke up feeling dizzy, with chest pain and blurred vision. Her family rushed her to the hospital, fearing she had suffered a stroke or heart attack. However, initial tests showed no abnormalities, and the doctors concluded it was just anxiety, and she was sent home. But just one day later, she suffered a severe stroke. This time, the doctors re-examined her, using a different method, and discovered the truth. Biotin had interfered with the test results, causing them to be inaccurate. Specifically, the high dose of biotin had reduced the accuracy of key tests like troponin, which is used to diagnose heart attacks and strokes. This led to a misdiagnosis and the dangerous condition being overlooked. Biotin had hidden the actual signs of a heart attack, putting both her and her family in a perilous situation. When taken in high doses, biotin can distort the accuracy of tests in individuals with cardiovascular issues or those at risk of stroke, leading to missed opportunities for timely treatment. High doses of biotin can distort test results and reduce the ability to detect early signs of serious conditions. Moreover, biotin can cause severe consequences if you don't understand how it affects your body. It's important to note that, although biotin is considered a useful supplement for hair and skin health, most people do not need additional biotin if their diet is already balanced and nutritious. You can easily get the necessary amount of biotin from natural foods such as eggs, nuts, and whole grains. When using biotin as a supplement, especially in high doses, you're taking on an unnecessary risk. If you are using biotin or beauty products containing biotin, be sure to understand the dosage and its effects, especially if you have cardiovascular problems or are preparing for important medical tests. Always consult your doctor before starting to use these vitamins to ensure that you're caring for your body safely. Vitamin C has long been known as a close friend to the immune system. Everyone knows that vitamin C helps the body fight colds, boosts resistance, and supports healthy skin. Because of these benefits, it's considered an essential part of daily nutrition, especially during the colder months. You can easily find vitamin C in orange juice, effervescent tablets, supplements, and it's always present in the medicine cabinet of every household. But did you know that while vitamin C is often seen as a great natural solution to maintain health, when used incorrectly, especially in high doses at night, it can seriously affect your blood pressure and increase the risk of stroke? One case I encountered was that of Mr. Gerald Monroe, 80 years old, a serious man who always had the habit of taking vitamin C every night to boost his health. He started taking 3,000 milligrams of vitamin C every night before bed, hoping it would help him stay healthy through the flu season. Like many others, he thought that a nightly dose of vitamin C was harmless and would help protect his body from illness. Unfortunately, he didn't anticipate that this action would cause a serious health issue. After several weeks of taking vitamin C, he began feeling unwell, waking up every morning feeling tired, dizzy, and unable to stand. One day, his daughter noticed he was slurring his speech and immediately took him to the hospital. Upon examination, doctors discovered that his blood pressure had spiked suddenly, and he was experiencing a mild stroke, also known as a transient ischemic attack, TIA. So why did this happen? Vitamin C, when taken in high doses, can stimulate the adrenal glands, increasing the levels of cortisol, a stress hormone. Cortisol naturally rises in the morning to help the body wake up. But when you consume vitamin C before bed, it increases cortisol levels at night, raising blood pressure and putting pressure on your cardiovascular system. This is especially dangerous for those with heart problems or blood pressure issues. This condition can develop silently, without you realizing, as the blood pressure changes caused by vitamin C don't cause immediate pain. However, for older adults, especially those with weak blood vessels and unstable blood pressure, taking vitamin C at night can be a ticking time bomb, leading to stroke or a serious TIA without any warning signs. Vitamin C can provide many health benefits, but when used at the wrong time or in excessive amounts, it can lead to serious issues. Research shows that the recommended daily dose of vitamin C for older adults is around 75–90 milligrams, and there's absolutely no need for high doses like 1,000 to 3,000 milligrams that many supplements advertise. Taking too much vitamin C, especially at night, not only serves no purpose, but also harms your cardiovascular health. So, what should you do? If you are taking vitamin C every day, especially in high doses, I recommend reducing your intake and avoiding taking it at night. Instead of continuing to take effervescent tablets or large amounts of vitamin C daily, switch to a balanced diet with plenty of fresh fruits, such as oranges, tangerines, strawberries, and other vegetables, to naturally and safely provide vitamin C to your body. Always remember, while vitamin C is an essential part of the diet, taking any vitamin should be controlled and adjusted according to the body's needs. Before continuing to use supplements, make sure to consult with your doctor, especially if you have high blood pressure or heart problems. Magnesium is a crucial mineral for the body, especially for cardiovascular, nervous, and muscle health. It helps maintain normal muscle function, regulates heart rhythm, supports metabolism, and even promotes relaxation, particularly at night. That's why magnesium has become a popular choice in sleep aids and supplements for older adults, especially those who struggle with sleep or experience nighttime muscle cramps. However, despite its many benefits, few people realize that incorrect use, particularly in high doses or at the wrong time, can cause serious health effects. One of the most notable impacts of magnesium is its ability to suddenly lower blood pressure, leading to dizziness, falls, or even serious injuries, particularly in those with cardiovascular issues or weak blood vessels. The story of Mrs. Linda Callahan, 84, serves as a prime example. She had always been an independent woman, able to take care of herself, garden, and drive locally. Recently, she started using magnesium citrate every evening after hearing from friends that it would help her sleep better and reduce anxiety. She took 400 milligauss of magnesium daily, thinking it was a safe and natural supplement. However, after some time, she began to feel occasional dizziness, especially when getting out of bed at night. One evening, when she stood up to go to the bathroom, she felt dizzy and lost her balance. Unfortunately, she fell and fractured her hip, along with a mild head injury. When taken to the hospital, doctors confirmed that she had experienced a sudden drop in blood pressure upon standing, a condition known as orthostatic hypotension. The primary cause was the effect of magnesium, combined with other factors such as aging, dehydration at night, and less elastic blood vessels. Magnesium can lower blood pressure, which is beneficial if you have high blood pressure. But when used incorrectly, particularly at night or after meals, it can lead to serious issues. At night, our bodies are in a relaxed state and do not respond as quickly to changes as when we were younger. When you stand up too quickly, the change in blood pressure is not adjusted in time, leading to dizziness and falls. Moreover, when combined with other medications, such as blood pressure drugs, sleeping pills, or sedatives, magnesium can amplify side effects, causing blood pressure to drop too low and leading to fainting or other complications. So how can you safely use magnesium? The appropriate magnesium dosage for older adults is about 350 milligrams daily, but you should avoid taking it at night if you have a history of low blood pressure or cardiovascular issues. Be sure not to combine magnesium with other medications without consulting your doctor. It's important to take magnesium at the right time and not exceed the recommended dosage. If you experience dizziness or feel unwell after taking magnesium, or if you've had blood pressure issues, stop using it and consult your doctor immediately. Magnesium is an excellent supplement when used correctly, but if used incorrectly, it can cause serious harm. In conclusion, while magnesium can help improve sleep and soothe the body, using it without understanding its side effects can lead to unforeseen issues. Always remember, your health is the most important, and understanding the proper use of any vitamin or mineral will help you avoid unnecessary risks. Vitamin B6 is one of the most commonly used vitamins to support brain function, improve memory, and reduce symptoms of memory decline. It is found in many nutritional supplements, especially in pills that claim to support the brain or boost energy. For older adults who often face concerns about memory loss or dementia, vitamin B6 seems like a safe and sensible option to protect the brain and maintain mental clarity. However, what few people realize is that when used in high doses, especially over an extended period, vitamin B6 can harm your nervous system. While vitamin B6 can be beneficial in certain cases, overuse can lead to neurological poisoning. This can result in symptoms such as numbness, muscle weakness, difficulty walking, and even loss of coordination. The story of Mr. Carl Patterson, 79, clearly illustrates the hidden dangers of abusing vitamin B6. Mr. Patterson, a retired mechanic, began taking a brain support supplement he bought online. This product contained 100 milliliters of vitamin B6 per pill, and he took 2 pills every day, thinking that the vitamin would improve his memory and energy levels. However, after nearly a year of use, he began to experience strange issues. His legs were frequently numb, he felt weak, and sometimes he tripped while walking. Initially, he thought it was just aging, or perhaps a common neurological condition. But when he saw his doctor, tests revealed that his numbness and muscle weakness were due to vitamin B6 toxicity. The high dose of vitamin B6 he was taking had damaged his nerves, causing paralysis and making it difficult for him to control his muscles. The reason for this is that when taken in excess, vitamin B6 can destroy the protective layer around nerve fibers, similar to how the insulation on electrical wires wears away. This prevents nerve signals from being transmitted properly, causing numbness, difficulty walking, loss of coordination, and even permanent damage if not treated promptly. Although vitamin B6 is an essential nutrient with many benefits, when used in excessive amounts, it can cause serious harm to the nervous system. Research shows that the safe recommended dose of vitamin B6 for older adults is about 1.7 mg per day. However, many supplements today contain up to 50 mg, 100 mg, or even 200 mg of vitamin B6 per pill, far exceeding the body's needs. So, how can you safely use vitamin B6? First, if you're taking vitamin B6 supplements, make sure the dosage doesn't exceed the recommended amount. Ideally, you should get vitamin B6 from natural food sources like chicken, fish, bananas, and nuts, ensuring your body gets the right amount without worrying about side effects. If you are using vitamin B6 for brain support or to alleviate neurological symptoms, consult your doctor before starting any supplementation, especially if you notice any unusual symptoms like numbness, muscle weakness, or difficulty walking. Stop using it immediately and seek timely medical advice. In conclusion, while vitamin B6 can support brain and nervous system function, improper use can lead to serious side effects. Always exercise caution and make sure you're using it safely, particularly as you age and your body no longer processes nutrients as efficiently as before. After learning about the hidden dangers of vitamin supplements, you might be asking, so, what should I do to protect my health without worrying about the side effects of vitamin pills? The simple answer is to return to a natural, balanced diet. Whole, unprocessed foods contain all the nutrients your body needs to maintain health without the dangerous side effects that pills can cause. First, it's important to understand that our bodies are designed to absorb nutrients from real food easily and efficiently. Vitamins, minerals, fiber, and other essential nutrients found in foods like leafy greens, fruits, whole grains, seeds, and legumes are perfectly processed and utilized by the body without the need for supplements. Using multivitamins, especially when not prescribed by a doctor, can lead to nutrient overload, which may harm the body. A diet of whole foods naturally provides the vitamins and minerals your body needs, but without the side effects that vitamin supplements may cause. For example, instead of using vitamin C pills or biotin supplements, You can choose vitamin C-rich fruits like oranges, tangerines, strawberries, or kiwi. These foods not only provide ample vitamin C, but also offer fiber, flavonoids, and other compounds that help the body absorb and use vitamin C optimally. The benefits of using whole foods over supplements go beyond just providing adequate nutrition. They also help the body digest and absorb nutrients more effectively. When you eat fresh foods, your body not only receives vitamins and minerals, but also utilizes natural compounds like antioxidants, fiber, and enzymes that protect the body from illness. Foods like leafy greens, berries, legumes, chia seeds, and fatty fish like salmon are excellent sources of nutrition you should include in your daily diet. Additionally, a balanced diet with whole foods supports the body's functions without worrying about overdosing or dangerous interactions with medications. When your body receives sufficient nutrients from food, functions such as immunity, circulation, and digestion operate more efficiently. This not only helps maintain long-term health, but also minimizes the risk of chronic conditions such as high blood pressure, diabetes, or cardiovascular issues. However, replacing supplements with whole foods doesn't mean you can eat anything without control. You still need to maintain a balanced diet rich in fruits, vegetables, quality proteins, and whole grains, while avoiding processed foods, excess sugar, and unhealthy fats. If you have specific health concerns, such as a vitamin D or omega-3 deficiency, you may need to consult your doctor before changing your diet or choosing to get those nutrients from food. If you find it difficult to change your eating habits, start with small steps. Add a bowl of vegetables to your lunch, replace processed snacks with an apple or a handful of cashews, or instead of taking vitamin C pills, drink a glass of fresh orange juice. You can also try making nutrient-dense meals like a green salad, bean stew, or baked salmon with chia seeds. These small changes will help you provide your body with all the nutrients it needs without worrying about taking supplements. A natural diet not only provides nutritional benefits, but also helps reduce the unwanted side effects of supplements. Your health improves holistically without worrying about the negative impacts of synthetic pills. So, before continuing to use multivitamins, consider replacing them with fresh, natural foods. This will not only help your body get all the essential nutrients, but also help you live a long and healthy life without the hidden risks of taking pills. Remember, whole foods are always the safest and most effective choice for your body. After exploring the hidden dangers of using vitamin supplements, you may feel confused and wonder if you've been doing the right thing for your health. But the most important thing to understand is that while vitamins and supplements can offer benefits, they also carry risks when not used properly, especially for older adults whose bodies have undergone significant changes. Not every vitamin pill is a magic cure, as advertised. Sometimes what you think is safe can hide potential dangers you never expected. Misuse can lead to serious consequences, from elevated blood pressure and nerve damage to more dangerous issues like stroke or cardiovascular disease. This is even more critical as we age, when our ability to absorb and process supplements becomes more difficult. Therefore, before deciding to add any vitamin to your diet, you should ask yourself, do I really need this? Perhaps you're taking them out of habit because of advertisements or because of advice from friends. However, if you don't fully understand them, and how they affect your body, you could be unknowingly harming your health. This is why consulting with your doctor is essential before starting any supplementation regimen. Natural foods are always the safest choice for your body, especially when they provide a rich source of nutrients that are easily absorbed. Fruits, vegetables, legumes, whole grains, and protein-rich foods like fish, lean meats, or eggs can all provide the vitamins and minerals your body needs without the dangerous side effects of supplements. And importantly, when you eat fresh foods, your body not only receives vitamins, but also benefits from the natural compounds that help protect and maintain health. If you're worried that your current diet isn't enough to provide sufficient nutrients, instead of rushing to take vitamin supplements, start by improving your daily diet. Additionally, if you feel the need to add specific vitamins or minerals, consult your doctor to make an informed and safe decision. Lastly, always remember that your health is priceless. Don't let vitamin pills be the deciding factor in your health if you don't fully understand them. Eating whole, natural foods, maintaining a balanced diet, and combining these habits with a healthy lifestyle and regular physical activity will help you maintain long-term health without worrying about the unwanted side effects of supplements. Caring for your body and health wisely is the best way to protect yourself. Always remember that when you are well informed about what you're putting into your body, you will make better choices for your health. So, start with small steps like changing your eating habits, adding fresh foods to your diet, and limiting the use of vitamins to build a healthy and sustainable body. Final advice: don't let advertisements or wrong habits influence your health. Always consult with your doctor, and more importantly, listen to your body. Long-term health is the result of making the right choices and taking care of yourself now.